Good morning, and welcome to this first session for the HU Ideas Symposium, um, From Protest to Policy, the Pursuit of Racial Justice. My name is Dana Williams, and I am Interim Dean of the Graduate School at Howard University and one of the co-chairs for this week's events. We want to say happy homecoming to everyone and welcome to all of you who are joining this webinar. We have really exciting programs over the course of this homecoming season, and the HU Ideas Festival in this specific symposium is but one of them. So we really invite you, if you haven't already, to visit the homecoming site and to take a look at all of the activities that are happening, and then very especially to take a look at some of the other panels that will happen over the course of the day. The organizers of this symposium were excited to work with the theme for this year's homecoming, which was advocacy. As you well know, Howard boasts a legacy of research, scholarship, and community engagement, all of which speak to the theme of advocacy and activism. We pride ourselves on providing solutions to human problems at Howard, problems that are true to those of us in the United States and then throughout the world. I have the pleasure now of introducing our speakers today, and we'll introduce one at a time as they're coming in. So I now invite our first speaker to turn her camera on. Thank you so much, Shareefah. And she'll tell you a little bit more about her specific research as we think through this particular panel, which is titled Transforming the Lives of African Americans, Mental Health, Wellness, and Economic Power in Brown and Black Communities. The panel focuses on bridging the gap between health and economic injustice. Panelists will discuss the impact of the social determinants of health, will provide historical context for health and economic injustice, and suggest policy-driven solutions for healthcare and economic reform. Our first speaker is Dr. Shareefah Uqdah, which I always don't get right, but I'll work on it, I promise. Shareefah has a longstanding commitment to improving the lives of minorities through mental health initiatives. At Howard, she serves as the Director of Training and Associate Professor in the APA Accredited Counseling Psychology Program. Her published research examines issues that impact urban families, urban schools, and African American Muslims. She has received over $2 million in grant funding to help decrease mental health disparities within undeserved communities. So you'll give us our title, and then our next speaker will be Dr. Jules Harrell, and then Dr. William Spriggs. So take it away, please.
So good morning, and thank you all for joining. As Dean Williams indicated, I definitely position myself as a family researcher and really understanding the way families navigate risk embedded in urban communities and how they have sort of innate resiliency factors that help them navigate those risks. Today, though, I'll be speaking a lot more broadly regarding sort of social determinants of health and how those are connected to economic injustices and what we can do as individuals and what policies we can begin to implement to sort of alleviate those injustices. So some of the things that we know in terms of health injustice, I'll just give you a few facts. African Americans, Hispanic Americans, and Native Americans have rates of diabetes that far exceed those in non-Hispanic whites. African American women are more likely to be diagnosed with advanced stage breast cancer compared to white women and have the highest rate of mortality from breast cancer. African American men and women are more likely to die of cardiovascular disease than non-Hispanic whites, and infant mortality occurs within the African American community 1.5 to 3 times more than other race or ethnicity. More than 30% of the direct medical costs faced by Blacks, Hispanics, and Asian Americans can be tied to health inequities. And only 1 in 3 African Americans who need mental health care receive it. And when compared to non-Hispanic whites, African Americans with any mental illness have lower rates of service use, including prescription medication and outpatient services, but a higher use of inpatient services. So, what that means is that when African Americans um, have a mental illness, they're less likely to be treated in what we understand to be the ways that will reduce or mitigate severity. So they're not going to be prescribed medication by their primary care physician, and they're not going to engage in outpatient services. However, they are more likely to be hospitalized and hospitalized in what we call inpatient settings to receive mental health services. And then also in terms of mental health inequities, when compared to whites, African Americans are less likely to receive guideline consistent care, less frequently included in research, and more likely to use emergency rooms or primary care rather than a mental health specialist. And so, how does all of this relate to economic injustices? And how do these health disparities and mental health disparities relate to some of the systemic things that we understand about the economic impact and really poverty? So what we know that most minority communities have lack and a lack of economic influx regarding healthy food, healthy homes, and healthy spaces. So if we look at the economics regarding healthy food, and it's important that when we talk about healthy food, we understand that diet is one of the most amenable ways that we can reduce a lot of the health disparities. When we're talking about diabetes, when we're talking about heart disease, when we're talking about even some forms of cancer, we're talking about things that we ingest and healthy food. And so what we know that 50 years ago, small neighborhoods, including neighborhoods that are mostly populated by African American and other ethnic minorities, there were common mom and pop markets, and it was common in small towns and in more ethnic minorities communities. But today, research suggests that markets only make up 17% of the grocery landscape in the United States. And so, because of that, it is likely that more ethnic minorities live in high food deserts and in regions where they have less adequate resources to obtain healthy, nutritious meals. Um, there's also research in regards to healthy spaces, that there's a concentration of toxic air pollution and water pollution in communities of color and in low income communities. There are too few safe, close to home parks and coastlines where youth and individuals are able to go outside. And so there is definitely a decline when we think about Flint, Michigan and the water crisis, when we think about building green spaces in ethnic minorities communities that we know also increases health and well-being as well as mental health. There's a lack of funding and a lack of priority of creating such areas within ethnic minority communities. And then lastly, we think about healthy homes. So within healthy homes and healthy schools, within our homes and schools, there's an increased use of corporal punishment as well as an increase in use of zero tolerance disciplinary strategies within our schools. And so these things can also be traced to economic injustices, such as a lack of funding of programs that work to identify what they label as at-risk homes, where mothers who may be lower in age, teenage mothers, or who may be currently receiving welfare benefits. We know that where there are home engagement programs, where they send nurses and or social workers to those mothers' houses, that improves the mother's mental health, that improves that decreases the risk of infant mortality in those homes, and increases the likelihood that the mother will engage in nursing and other sort of early parental child relationship factors that create resiliency for individuals who may be residing within urban communities. And then we also know that the increase of zero tolerance policies within schools increases the prison to pipe school line, where children who get expelled and suspended are more likely to show less academic progress, and eventually may drop out or not make successful academic gains within the schools. And so when schools are underfunded, when schools are under resourced and do not have adequate staffing and or have high teacher turnover and lack of school mental health professionals, those are the schools who are going to be more likely to use zero tolerance disciplinary strategies. And so when schools aren't funded and aren't given adequate resources, we see these negative outcomes in terms of achievement, which further decreases individuals and communities' abilities to make money and be successful, quote unquote, and to be able to then mitigate some of the other risk factors embedded in these communities. And so when we think about this locally, right, I'm in Washington, D.C., but when we think about how this looks locally, what we know specifically in terms of school, recently they released a report regarding modernization of schools. And so in DC, Ward 7 and Ward 8, which are the wards that house the highest number of ethnic minorities and also has the lowest median household income, those schools have the lowest percentage of fully modernized schools. So Ward 7 has 50% of fully modernized, Ward 8 has only 44%, while Wards 3 and 2 have the highest percentages of modernized schools. So Ward 3 has 100% schools at fully modernized, and Ward 2 has 75% of schools fully modernized. And so these are things that are systemic. These are things that we really do need real policies to address and attempt to mitigate. And so I'm going to go through just a list of simple things that we can do at a national level, and then talk about some of the things that we can also do individually, because as we understand that there are things that we need to advocate for in terms of our leaders, in terms of our elected officials, and in terms of corporate organizations that we purchase from, there are also things that we just want to begin to do for ourselves as well. So one, we need to begin to advocate for funding for parks, recreation, and community beautification areas within where we live. We have to begin to push for small things, just as an increased number of trash cans, an increased number of proper sewage draining, an increased number of street cleaning, and the building and renovation of parks and recreation areas. We also need to fund HBCUs. We know that HBCUs produce the most teachers who are African American. We know that when we are talking about educational outcomes for African American and minority youth, that having one African American teacher before third grade increases the likelihood that an African American child will go to college. And so we have to fund HBCUs not only to diversify the teacher population, but also to engage in research that specifically looks at ethnic minorities in order to make sure that what we understand as good science and good practices are really based on us as opposed to other larger groups. And then we also need to push funding agencies to mandate that research institutions, those who receive lots of federal funding dollars must begin to partner with HBCUs to ensure that they have adequate sampling of African American population, but also in an innovative way and the strength-based way that we look at our community. We need to increase public funding for schools that have large minority student populations. We need to commit to stop using all zero tolerance disciplinary policies and defunding policing strategies within schools while increasing teachers' pay and the number of mental health professionals within schools. We need to increase funding for family engagement and community outreach services within all government funding agencies. And so this goes beyond, we sort of think that um, schools or parks or recreations need to have outreach services. But I would think that when we look at the Department of Housing and Urban Development, that they need to have a community engagement and outreach service that we know immediately how to get to and who to talk to, and to be able to access these agencies in a much um, quicker way, in expeditious fashion. We need to create automatic Medicare and Medicaid enrollment for all providers, especially mental health providers. We know that most lower income families have some form of Medicaid or Medicare for health insurance, but I am not only a professor, I'm also a licensed clinical psychologist, and you would be amazed at the amount of work and paperwork that you have to go through in order to be able to take Medicare or Medicaid. And so most people, most private professionals, medical doctors, and especially psychologists, mental health professionals who may have smaller practices are not willing to do that. And so they have to begin to make that automatic and to increase the amount of payment that providers get when they are paneled with Medicare and Medicaid. Also, we need to begin to have full access to, and by full access, I mean just information regarding companies that receive federal monies and tax break and their percentage of diversity. So if they are receiving federal monies of any kind, tax breaks of any kind, they should begin to submit diversity reports that's publicly available and that speaks to the percentage of diversity within their board of directors and their executives and their consumers. So we want to begin to look at, are they selling products? Are they selling services to diverse communities, but that diversity is not mirrored in the people who run their organization? And then what can we do as individuals? Some of the basic things that we know that mitigate some of these health disparities and mental health disparities is that we want to begin to work on just eating well. So we want to crowd our meals with fruits and vegetables. We want to get the recommended exercise weekly. We want to begin to sleep well. We want to go to bed at night. Again, like I said, I am a practicing psychologist. And so you would be amazed at how many of my clients just don't have a good sleep routine and how that impacts their mental health and their daily functioning. We also want to begin to practice meditation. I tell clients, I tell individuals all the time, just think about dosage. So a little bit goes a long way if you repeat it consistently throughout the day. So when we're thinking about meditation, just think about deep breathing exercises, maybe 30 seconds, 5 times a day, right? So just 1 minute in 5 hours, just pause and take deep breaths. And then we also want to commit to stop using physical punishment with our children. I know sometimes we understand this as a cultural phenomenon, but if we are attempting to eradicate violence outside of our homes, we also want to begin to try to lessen it and or eradicate it within our home. So when you feel the urge to spank a child, just set a clock for 60 seconds, try to breathe, and then come back to the situation. And then lastly, go to therapy. If you can't afford therapy, I always recommend people to engage in bibliotherapy. So read self-help books and then practice what those books say in terms of wellness. So just choose one area that you may feel like you want to grow in or that you want to improve on and read a self-help book related to that, and then practice one or two of the strategies that they provide.
Thank you, Dr. El Akhtar, for that information. I would like to now transition to Dr. Jules Harrell, who is a professor of psychology at Howard University. He is the author of the book Minuchin Psychology, Racism, and the Minds of People of African Descent. Along with his graduate students, he has published articles related to the psychological process and psychological variables in the Journal of Black Psychology, the American Journal of Public Health, Psychological Bulletin, Biological Psychology, Ethnicity and Disease, the Journal of Psychophysiology, and the International Journal of Psychophysiology. Dr. Harrell?
Thank you so much, Dr. Carter-Nolan.
You're welcome.
I think I can control these slides, I believe, and that'll keep me on time because I know we were limited to our 8 minutes. And I just wanted to say a few words about health and about our role in preserving health in our communities. And so that's basically what this is about. But we have to remember that we're all at home, locked away in these little rooms, and strange things happen sometimes when we do that. So if I can go to the next slide, please. Okay. And what happened to me is that I ran across an old book by James Baldwin that sort of framed what I wanted to say today in many ways. And so I hope that this works for you. But this is from his essays, and this is 1972, he wrote this. And Baldwin is basically quoting Job here, and he says, his remembrance shall perish from the earth, and he shall have no name in the streets. He shall be driven from light into darkness and chased out of the world. And that to me was the most chilling kind of a statement. And then I ran the next slide, right. I, of course, at that time was reading the life of Mr. Freddie Gray, who was murdered by the police in Baltimore. And Wes Moore makes some very interesting observations about his life that I think affect the way that we look at wellness and the way we look at healing in our particular society. And it really goes back to what the last speaker was talking about, that we've got to work at a variety of levels. So if I could have the next slide through here. All right, and this is the statement that he makes that was so chilling to me, that he says that Mr. Gray grew up in the type of poverty that permeates everything: how you are educated, the water you drink, the home you live in, the air you breathe, the way you are policed, and whether or not you will die in the same poverty you were born in. That's important to those of us in public that look at public health, or that are concerned about health and social processes. And for the particular model that I want to look at on the next slide, it says that, in fact, when we take the individual, think about the individual at the core, there's a variety of systems that sort of surround that individual. This is something that developmental psychologists use a lot, called and I'm calling it a bioecological model. I think it's because Uri Brofenbrenner, who put it out, talks about the fact that we come into the world, but in fact, a variety of systems around us operate on us to sort of socialize us into being in the world. All right. And these go from what he calls microsystems, which are, family, church, and these kinds of things, all the way out to the macro systems, the larger systems in the society and the culture. All right. Next slide, please. What we have to remember is that we exist in society that is essentially inequitable. All right. That inequalities are not simply an exception; they are the rule. And the model I just showed shows that that we have concentric circles of influence that impact how we grow and develop. That the argument being made by Wes Moore about the life of Freddie Gray is that for many individuals in oppressed groups, there are gross failings at each and every level of influence on Brofenbrenner's circle. That everything went wrong for Mr. Freddie Gray from the point of even prenatally, all right, from the early exposure that his mother was in fact exposed to drugs during his pregnancy, that he was exposed to lead during his early life, the school system fails him. Everything in that circle ends up failing him. And that is, in fact, the kinds of problems that we're working with. There are problems that are multi-level, not problems just at one particular level on those concentric circles. Okay, next slide. Okay, this is, I think, some statements here that will help us understand how wellness takes place in a society, how we, what happens to us. And Nancy Krieger, in her book Epidemiology and the People's Health, basically says that we literally embody biologically our lived experiences in societal and ecological contexts, thereby creating population patterns of health and disease that we embody, all right, biologically, our lived experiences, that those individuals who live within oppressed communities, there are communities that are subject to any level of racism, from the individual up through the structural and systematic, all right, their health patterns will embody those particular experiences that they're having. Next slide, please. And this is Kamara Phyllis Jones talking more specifically here about the same process. That now she's talking about people scratching their heads around April 7th of 2020 about, well, why are these rates of pandemic, the rates of not only hospitalizations but death related to the pandemic, why they seem to be breaking down on racial lines. And she just simply says that pandemic, COVID-19 pandemic shows us how segregation of resources and risks, societal devaluation, and environmental hazards and degradation are written into the bodies of people of color and poor people. That this is, again, another process of what we would call the embodiment or the translation from the society we live in into the bodies of our, of those who are oppressed. Much like what happened to Freddie Gray, but only from a point of view now of a much subtler COVID virus this coronavirus taking over and doing the same thing that, in fact, the Baltimore police did in Freddie Gray's situation. But at all levels, these things are operative. All right, next slide, please. This is an interesting kind of a slide to me. This is from a paper that came out in the British medical journal called Lancet about a year or two ago. And what this particular study did is it went through and studied African-American communities across the United States. And it sort of partitioned those communities into those that had had a killing of an unarmed Black person by police within 6 months prior to their survey, and those that had not. So you have two large groups. Now this is a sample of around 16,000 people. It's much more than that, 16,000 that had actually lived in communities that where there was a killing, but the control group was much larger than that. All right, and then what they were concerned with was what was the impact of that on the number of poor mental health days people reported. The study is a carefully controlled study where they look at a variety of factors, and then they look at things across, they look at this whole process across time. Where you see in the portion of this graph that is in gray is prior to the occurrence of any kind of a police killing. And then what happens is that shortly after there is a killing of police, there is a significant increase in the number of mental health days African-American people are reporting, bad mental health days that they're reporting, so much so that they start losing work. And the study just simply goes through and shows how many work days are lost a year because people sort of suffering from the mental health consequences of these these actions by the police. And so again, mental health, an outgrowth of what goes on in our larger society. Next slide, please. The next one is just simply the most, you've seen this one a lot before. This is sort of the coronavirus rates, again, most recent stuff I could get from the CDC, that just simply tells us about how in these communities of color, there's a higher rate of both cases, hospitalizations, and death that we're finding 2 times higher, 4 times higher for the hospitalizations for African Americans. These again are the translation of, this is a translation of what's going on in the society into the impact of an infectious disease. All right. understanding that the fault lines are set up by the structures. All right, next slide, anticipated me beautifully. All right, and this is toward the end. So what we have to do now is figure out, what are we going to do? What are our actions going to be in this particular situation? And again, we're locked in these rooms, and James Baldwin jumps off my shelf with this book, No Name in the Street, and he gives this an anecdote that I'll never. It's in my mind forever. And he talks about a friend who this is right around the time that Dr. King is assassinated, and he has a friend who, in fact, is in need of a suit to go to a small banquet that they're going to sort of give this friend an honor for working 20 or 30 years on a particular job. But the friend, Baldwin's friend, doesn't have a suit. Baldwin has this suit that he wore to Dr. King's funeral, and he's not. He doesn't feel like wearing that suit anymore because he feels that there's a certain sadness about it. All right. And so his sister tells him about the situation that a friend of his is in need of a suit. Use that as an analogy to this whole notion of what can we do. And Baldwin says this to us. He says he couldn't afford to throw suits away. He couldn't, in short, afford my elegant despair. He says Martin was dead, but he was living. He needed a suit, and I was just his size. My argument is that even though we are, distressed by certain things, people need suits out here. People are just our size, that we can reach out and help individuals through our disciplines. Next slide, please. That each discipline must say the names. That is, we must reach out and do things about what's going on in our communities. The causes of our health inequities, as you've seen in this little short presentation, are multi-level. The solutions will be multi-level also. It's a call to the disciplines from microbiology to macroeconomics, from the arts to the engineering. All of our disciplines have to get involved in this process. It's an all hands on deck kind of a thing. Each and every unit engaged in correcting inequities and healing the impact of these inequities. That is, all of our disciplines now have a therapeutic role. This is consistent with the education's mission to basically humanize and inspire us. We have to shout the names of the oppressed, say what's going on with them, and we have to supply them a code. Thank you. That's it. There we go.
Thank you, Dr. Harrell. Thank you very much. And now we're going to transition to our third panelist, Dr. William Spriggs. Dr. Spriggs is a professor in and a former chair of the Department of Economics at Howard University and serves as chief economist to the American Federation of Labor and Congress of Industrial Organizations. He is currently on the advisory board to the Minneapolis Federal Reserve Bank Opportunity and Inclusive Growth Institute. In 2014, he was the recipient of the NAACP Benjamin L. Hooks Keeper of the Flame Award, and in 2016, he received the National Academy of Social Insurance's Robert M. Ball Award for Outstanding Achievements in Social Insurance. Dr. Spriggs, I welcome you.
Thank you, Dr. Carter-Nolan, and thank you to my fellow panelists for keying this up. I want to follow up on their points because I think Dr. Harrell's slide showing the way in which we live in a system, and he showed the individual in the center of it, but surrounded by a globe is the starting point I want to have. And I want to take his charge that each of our disciplines, as he said, from microbiology to my discipline, macroeconomics, play a role. Key in this is what I consider to be the crucial element of our own, meaning Black people's, Achilles heel. We have two portions to that Achilles heel. One is our tendency, our cultural tendency to always worry about the least. And we should have that focus, but sometimes we lose the bigger picture from that focus. That is, we forget our own needs. So many times we are lifting up, but we forget that we ourselves have to be lifted up. Second thing is our tendency to want to be survivors. We endured the Middle Passage, we endured slavery, we endured Jim Crow, we are survivors, and we very quickly go to survivor's mode, but the fault line in that tends to be that we think it is something that we can do individually. And the problem tends to be that we are susceptible to people yelling at us and claiming that we should not be victims, that we should be able to solve these problems. The problem is they're saying we as individuals should be able to solve this problem. And what we're confronted with, as Dr. Harrell had that diagram, is that we aren't dealing with atomistic people. We aren't dealing with an atomistic situation. This is not individuals against individuals. This is not a competition of individuals. Systemic racism means that there is an organized group. And so if we seek solutions that are individual against something that is organized, you're not going to succeed. And we are forced into this view that we're supposed to do this as individuals. And so often as an economist, I'm asked these questions. What can I do? And when I give an answer about the system, I still get pushback with, no, but what can I do as an individual? This has severe health consequences. I have a very good friend, Derek Hamilton, who makes this analogy to John Henry, the African-American fable that many of us learn as children. And it's about this heroic Black individual who on their own is challenged with their job becoming obsolete. But John Henry, the pile driving man, is so powerful that he's going to take on the steam drill that's supposed to take his job. And he's going to beat this steam drill. Well, we all know the story. John Henry is so big, he is so powerful, that in fact, he beats the steam drill. But the end of the story is he dies of a heart attack. So we too often incorporate this John Henry syndrome. Yes, as an individual, if you are as big and powerful and supernatural as John Henry, you can beat the machine. But at the end of the day, you would have killed yourself. He does it on his own. He doesn't say, give me 10 men and I'll beat the steam drill. He doesn't take on the system with the system. He takes on the system as an individual. At the same time that we can defeat ourselves in that way, we also can turn in hatred, either against ourselves because we're all are not John Henry. You got to remember the story. He was born a steel driving man. He was born supernaturally strong. We can turn against ourselves and hate ourselves because we think we're supposed to be John Henry. Or we can hate others who look like ourselves because they aren't John Henry. We can say, oh, well, I don't know why you didn't do it. I'm John Henry. I beat the steam drill. You can beat the steam drill. Or the self-hatred turns into loathing. And I begin to believe that people who look like me have no value because the society is telling me you have no value. You aren't people of worth. You don't try hard enough. You're not doing what you're supposed to. And just as the police think you have no worth, I begin to think you have no worth. So not only can the police shoot you, I can shoot you. And we can turn that hatred inward on our own community. This is a moment when, as people, we have to reflect, because the systemic challenges we face are clear and obvious. So I just want to make a few points so that you can get what I'm saying, and we'll move on. First, if after I finish, you still believe that the problem that Black people have in the labor market is we don't have good education, we're lazy, our kids aren't responsible, please listen to the reality of this labor market. We all know that the Black unemployment rate tends to be twice the white unemployment rate. This has been the case for the last 50 years that we have data. This is like clockwork. There are very few identities in economics that are real. You heard all sorts of arguments about what is called the Phillips curve, the relationship between unemployment and inflation. And you heard debates going on nationally as the unemployment rate fell and everybody swore there was going to be inflation. And we had the problem during the Great Recession when unemployment didn't seem to be moving with inflation. But the 2-to-1, that's been true for 50 years. We don't have a single period in which I can say it wasn't 2-to-1. In April, we got shocked. A bomb was dropped on our jobs. 20 million jobs disappeared because of the coronavirus. The jobs just disappeared. The ratio of the Black to white unemployment rate was 1.3-to-1. It collapsed. Why? Why? Because all of a sudden we weren't watching the system. We were watching the reality of how do you actually allocate who should be employed and who should not be employed. This is a bomb that's dropped. It's not a system response. It's everybody just boom, do what you're supposed to do. So we weren't twice as likely as white people to be unemployed. We weren't. And in fact, if you control for education and you said, what should be the Black unemployment rate compared to the white unemployment rate based on education, it should be something like 1.2-to-1. Now, what has happened since April? The system now gets to recalibrate itself. And sure enough, it's going up so it can get back to 2-to-1. The Black unemployment rate is 2-to-1 to the white unemployment rate. The other thing we don't discuss, so I'm going to say this really slow because you're going to say, no, I didn't understand what he said. The unemployment rate for white high school dropouts, the unemployment rate for the least educated white person. You know, everybody says it's the quality of our education, blah, 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 blah. Okay, this is a white person who did not benefit from the quality of any education. They dropped out. They did not finish high school. The unemployment rate for white high school dropouts is lower over the last 50 years, every month, is lower than the Black unemployment rate, not the unemployment rate for Black high school dropouts. It is lower than the Black unemployment rate. So those of you who believe that our unemployment rate is because we don't have skills, the unemployment rate for a white person who has absolutely, positively no skills, did not finish high school, that's lower than the Black unemployment rate. As the Black unemployment rate has now been going up while everybody else's unemployment rate has been recovering from that shock in April so that we can get back to the 2-to-1, it's not just that the white high school dropout unemployment rate is lower than the Black unemployment rate. The high school dropout unemployment rate, the high school dropout unemployment rate, this is everybody's high school dropout. Hispanic, white, Asian American, the high school dropout unemployment rate is lower than the Black unemployment rate. That's been the last 3 months as our unemployment rate recalibrates to this 2-to-1. So this is The issues that we face in the labor market are systemic. It's not about us. It's not about our kids. This is a systemic issue. Second thing, as Dr. Harrell showed you, we are more likely to catch COVID. We are more likely to be hospitalized. But if you looked at that graph, or the table, if you looked at the table, you notice that while we were a lot more likely, almost 5 times more likely to end up being in the hospital, we were only twice as likely to die. So of course, in order to die from the disease, you had to get the disease. We are not more likely to die from the disease than we are to catch the disease. We're not dying because of underlying health disparities. The CDC did a study in April. They took the first 400 people in Georgia that they could get records for, and they looked at the cases of people in the hospital, and they looked at, are the Black patients more likely to have diabetes? No. Are the Black patients more likely to have asthma or other breathing disorders? No. Are they more likely to be obese? No. Are they more likely to end up on ventilation? No. Are they more likely to die? No. However, Black people were twice as likely to be in the hospital for COVID compared to the other people who were in the hospital at the same time. We were more likely to catch the disease. We were just as likely as everybody else to have everything else bad happen to you, including dying. But if you're more likely to catch it, more of you will die. And the data we have available, you see this. They looked at nurses and nurses who caught the disease because they're on the front line. Turns out that 20% of the nurses that they had information on who caught the disease were Black. And you go, yeah, but man, we're only 12% of the population. That looks really bad. Yes, but we're 20% of the nurses. We are overrepresented in an occupation that catches the disease. We're more likely to be bus drivers. We're more likely to be meat packer workers. We're more likely to be the person at the clerk at the store who's checking you out. We're more likely to be in the jobs that are on the front line that catch the disease. We're more likely by a lot to be the women who are in senior care facilities where we know the disease spread. We are more likely to have those jobs. So we have been dying not because of us, but because of a systemic system that put us at risk, which ties to my last point that I'm stopping. Unemployment insurance. We are more likely to be unemployed. We just went through that. Turns out these occupations that make us more likely to catch the disease are also the occupations which have been systemically eliminated from having access to unemployment insurance. Everything Congress did was meant to try and address that. But even with all that Congress did with their heroic efforts through the CARES Act, those occupations still are less likely to get unemployment insurance. We are less likely to get unemployment insurance precisely because we still have those occupations that in the 1930s had been eliminated from consideration because those were the occupations that Black people had. In that 90-year period, that hasn't changed. In that 90-year period, this hasn't changed. If we're fighting the system, we cannot look inward. It is not victimization. It's not playing the victim when in response to a group attack, we decide how do we act as a group to fight back. What can you do? You go find somebody else to join your fight. This is not your fight alone. Organize, organize, organize.
Thank you, Dr. Spriggs. I would like to invite our viewers to post their questions in the question and answer box on the screen. But I would like to ask our panelists, Dr. Spriggs, you mentioned that this was a systemic issue, and I totally agree. But where do we begin? We're in the midst of pandemic crisis, racial incidents, and just, you know, the challenges with health, the economy. So I would like to ask the panelists, from your point of view, where do we begin in addressing this, you know, systemic issue in this day and age?
Well, I would say it's fighting for undoing the policies that were put in place that got us in the situation we're in. I'll just start with unemployment insurance. We know we were excluded from unemployment. There was a reason these occupations were singled out not to be part of the Social Security Act. And we must fight to be included. So when we look at policies, when we look at politicians we're going to support, we have to get them dedicated to undoing these things that were designed to disparately impact us. We need to be upset that in this situation, OSHA, the Occupational Safety and Health Administration, which is in the Department of Labor, did not issue guidelines to protect workers who were on the front line, as we did when we had the H1N1 virus in 2009. One state, Virginia, has issued guidelines, but we should be fighting with our allies to make sure that there are worker guidelines to make workers safe on the job and not leave this to the whim of employers or their stupid commercial that they keep running and telling us, oh yes, we have workers' safety is our #1 concern. It's like, yeah, right. Well, that's what we must be doing. We must have our eyes open. All of our problems are man-made. All of our problems are man-made. They are made by policy decisions. The system that we're fighting against is a man-made system. And we must learn what are the policies that are hurting us, and we must fight against them. And we can't say it's my fault that a group of people passed a law. But it's my fault if I don't organize, if I don't vote, if I give up my voice, if I give up my organizing to fight against it.
Thank you. Dr. Harrell, do you have some words on where we begin to deal with this systemic issue?
This will sound strange coming from me, but it's really the last words that Dr. Spriggs talked about there, this notion of organizing, because we know it's going to be a multidisciplinary effort. The people in the arts, the people in the humanities, the people in architecture, wherever it is, we need to have some, they will all be involved in this thing. The organizing part is to make certain that these efforts are coordinated. So the policy people know exactly what the social workers are doing. All these kinds of things have to be connected. And I think that that can be done now. You know, we have communications vehicles that were not available to us 40 or 50 years ago. We can speak instantly to one another across disciplines or within disciplines. So I think that we've got ways now to carry out organization in a way that Kwame Ture, Stokely Carmichael could never have imagined how quickly we can get a hold of one another. So I think it starts there. I say that's a surprise to me to say that because, of course, the other thing that Dr. Spriggs talked about, and I think, well, we have two clinical psychologists on this panel, is the idea of self-care, and that is important. We have to really start with this notion of somehow making certain that we do the right things for our own health individually. We know what those things are, but we've got to do that and make certain that our children understand not that they should never get into the kinds of habits that we have to correct as adults.
Thank you, Dr. Harrell. Dr. Uqdah, would you like to comment?
Yes, I would just like to stress that in the line of John Henryism, it's also important to choose the correct battle and be okay with choosing just one battle. I think a lot of times we can be very distressed because we know there's a lot out there that we want to address, that we want to fix and eradicate, and we may spread ourselves too thin. So it's okay to organize around one issue or two, and then to focus on those policies, those initiatives that address those areas, and be okay with understanding that there are other people around us who's doing the work in these other areas as well. So I would just like to say that that is also one way that we can begin to address the problem.
Okay, thank you, thank you. So, Dr. Harrell, you mentioned a particular age group that, you know, seems to be in this fight, and that's the younger generation. You know, typically it's us at the forefront for the cause, but, you know, lately, and it could be everything that's going on, but it seems to be the younger generation that's at the forefront, and a diverse generation, diverse group of individuals. Do you have a comment about that?
Yeah, well, one thing I always tell people, and people don't always agree with me on this, but it's been my experience as a parent and now a grandparent that the generations behind my generation, that is my children and their children, they know the music of my time better than I knew the music of my father's time.
Mm-hmm.
All right. And one thing that was part of the, what was going on in the 60s, they sampled this stuff, is what they've done with it. They take it and they study it and they sample it, but they also picked up the lyrics a lot of times and the energy there. And so they know a lot of, they know a lot of the implicit history of our people. Maybe not the facts and the dates, but sort of like the flow of things. And it didn't surprise me, I grin broadly when I look at people out there I'll be blunt, in the Republican Party and some of these conservative folks that think that they've got, that these young people are sleeping. You know, that's fine, go ahead and think that. These folks are awake, and they bring with it an energy that the young person has that we lose with time, you know, that there is a warrior energy with that. And so I'm very, I'm just so gratified to see that they picked up on things, they've improved on, where we were years and years ago. They've improved on that. I think they've added a spiritual component to it that's extremely important. But yeah, in that sense, I'm quite gratified, and I'm quite hopeful that these folks, that they're going to grab the collars of this system that Dr. Spriggs has talked about now. They're going to grab it by the collars and shake it until it gets right. I think that's what we're looking forward to in the future, and we have to support that. It's not the exact way we would do it, but that's all right. It's their way.
Thank you. Would anyone else like to add to that discussion regarding the younger generation?
Well, I hope they keep up their energy and their knowledge of the technology. I always challenge them whenever I'm around Congresswoman Eleanor Holmes Norton. I remind young people that she was the frontline logistics person for the March on Washington. And I point out to them, she had a black dial phone, Rolodex, and that was it. And they have cell phones that let them send a tweet to 1,000 people, or Instagram to their 3,000 followers or their 100,000 followers. They have it on her in 2 seconds. And I encourage them to use that ability to get their friends to vote and make sure that their friends show up and vote. They have something that none of us had before, and it's a good thing. And I just want to reemphasize the point that Dr. Uqdah raised, which is, and this is what Dr. Harrell has been driving home. We all have something to contribute, and it's a team effort. So you got to understand your role on the team. And her point was so important. Don't think you got to do everything. We do this as a team. Football is back. If I'm the safety and I have the deep zone, I have the deep zone. If you're the quarterback, you have the man on the flat. Don't play my position. I won't play yours, and we'll win. But if I'm trying to get the man on the flat and you think you're going to do, the play will fall apart. There'll be somebody all by themselves in the end zone catching the ball. Everybody will say, who was covering him? So her point is exactly it. It's how you will stay mentally healthy. If you understand you have a talent, You have a gift, you have a role, play your part.
I think it's very important that we all play our role in the initiative. I totally agree with you all. And this panel is has great timing in terms of, you know, we're in the midst of election season and some of us have already started. So I think it's very important to understand playing our role and getting involved. I think that is very important.
I would just want to add that I really would encourage young people, middle-aged people, older people to increase the cross-generational conversation.
Yes.
I know that there, you know, I see this on social media a lot, we are not my ancestors. And I cringe because I know that that is a phenomenon of us not having spoken to our ancestors to just really see how bouted and radical and revolutionary our ancestors were and continue to be. And so I really just would encourage younger generations to initiate those conversations of how did you fight off real KKK, I mean, not real KKK, like the KKK now isn't real, but when they came and burned your churches down, you know, go back and actually study what happened after the Emmett Till case. Like, we're aware of what happened in terms of the larger facts, but many of us may not be aware that the sharecroppers where they worked, where Emmett Till's body were found, all of those sharecroppers left. They decided they weren't working on that farm anymore, and they said that we are not safe and we're not going to produce whatever limited amount of resources and power and control that we have. We're going to move that elsewhere where we feel safe and secure. And so we think that we didn't have ways of enacting our power, that our ancestors and our grandfathers didn't stand outside their farms with shotguns. You know, we don't necessarily know those stories because we aren't having those cross-generational conversations. And so I would just encourage all the generations to begin to do that within our homes and within our academic communities and social communities, to really find out just how about it we've been since forever, really.
It's interesting that you say that, because that is definitely something that has occurred in my household over the pandemic. So it's very important. You're right. So it's true that resistant narratives tend to be suppressed. So we have to recover those narratives. So what do you feel, how can we encourage individuals to begin to have this discussion, this cross-generational discussion? Because a lot of times, you know, it's trying to get individuals to open up and talk about certain things is very challenging. So how can we encourage this?
I would start out with listening. You know, I am someone who has grandparents and touching the hem of 90. And when I just asked them, well, how did you end up in New Jersey when you were born in this little P-dot town of somewhere in Georgia, Caruth, Georgia, actually. And my grandfather tells me that he was 12 and his father said he had to stay there. And he decided to hitch himself on a train to come to New Jersey by himself at 12 years old and make it in a city. I know that I hear a story of resistance. I know that I hear a story of perseverance. And that's just simply asking, how did you arrive here? And so I think that we have to begin to just be curious, right? Like, as a clinician, that's one of the things that we understand in terms of therapy, that we just want to be what we call empathetically curious, right? As opposed to being nosy. We really want to ask questions because we want to seek to understand their existence and the way that they came to understand themselves and their life. And so when we approach it from that framework, we will hear the stories of resistance and resilience, because all of our ancestor stories are going to have those themes and threads in the same way that our own individual stories have those themes and threads.
Thank you.
But could I just say that I would really make certain that we not neglect the role of the arts in this whole, and filmmakers and people that will take sort of the facts that that we have now a generation of scholars that put down the facts about the, the older generation and what they did economically and what they did in terms of jobs. That's there. But now we translate that into a narrative that young people can see. We take the music of an Ellington or Billy Strayhorn and some of those people, and we bring it up to date. Okay, here's what they were doing. And as they see these things artistically presented, because we have magic when it comes to these arts now, there's no doubt about it, then they'll be more curious about it. And I think that's where then the conversations get even richer, because they say, well, wow, he was doing the same thing that Biggie did, and it'll work on down the line. Oscar Brown Jr. sounds like, those kind of things will be connected. Those lines will be connected. But I think it's going to be through our presenting this thing artistically, through film, through television, these kinds of things.
Thank you. I agree. So staying mentally healthy it's not easy when we're dealing with so many different things. How do we cope and begin to recover from all of the loss, the deaths that we've been experiencing in the Black community, Black and Brown community?
That's an answer for someone with a license. Go ahead.
So coping with loss is a very complicated thing. And so I really stress the importance of understanding that it's going to be a cyclical process. You're going to have ups and downs of waves of strong grief and waves of feeling better. What you want to do is begin to connect with, I want to say, more indigenous forms of understanding spirit and flesh, right? Beginning to understand that life began before we had this physical body form, and life continues after we have this physical body form. And you see this within our culture quite frequently, right? You have a new child, you have a new baby, and your grandfather say, oh, he looked just like so-and-so, that looked like Uncle so-and-so, that looked, because the life is this continuation. And so when we are immediately trying to manage with grief and loss, we have to understand that while this physical flesh may not be here, the spirit, the energy, the works that they have created, the words that they poured into you remain, and you can honor that in multiple ways. So I encourage people to create rituals for mourning, right? Create ways that you continue to speak these individuals' names and give their life meaning, okay? I encourage people to do what feels good, right? If you are sad that day, acknowledge it. Don't beat yourself up and say, oh, I should be over it. No, acknowledge, oh, today I feel sad, I miss my mom, right? You can probably see her face back there on my screen. Acknowledge that, because when we acknowledge our feelings, when we acknowledge our emotions, that is a very radical form of self-care and self-love. And then the third thing is to create community. We have to very purposefully create community with the people who knew your loved one, with the people who know you and love you. Because we're not in this fight against systemic oppression alone, and we're not in this life alone. So push yourself to create your village and create community as well if you're dealing with grief. And then we also know, real quick, we know that African Americans use grief a lot to be transformative and engage in social justice activities. So that's why we have a lot of memorial funds, memorial scholarships. We try to use that energy to create something new. So you can do that just as simply as planting a tree, donating a tree to an impoverished community, naming a star after your lost family member. You also see it in forms of tattoos and things like that, but they try to do something to create something in memory of that person as well.
Thank you. So what is the role of the university as an institution in developing this way of seeing the world when many have it's been bombarded by some of the negative aspects of social media? What do you feel the role of the university is?
So I would say I take huge pride, and I used to ask this question when we were doing the self-accreditation self-study at Howard, and I was on the committee. What would be the way I would know a Howard grad? And I have finally hit on it. If someone immediately understands and knows agency on the part of Black people, I go, you went to Howard. Because to me, that is the marker. That is how I know one of our students, because they don't look at complex systems and see Black people as victims. They see Black people as problem solvers, and they immediately go to, okay, here's the problem. This is what Black people are trying to solve. What did they do? And I think the role of the university is to do exactly that, so that our students understand the history of resistance. They understand how this river that's so crooked and bent and sometimes runs dry and sometimes is wide and sometimes is narrow, all the places it went to get to here. And they understand how the river went against the rocks and went through the mud, and they get that. And that's the responsibility of the institution. That's what makes us unique. That's why we're so valuable. That's why I don't think there's any other university that could have produced the public leadership that we see from currently, the product of my department, Kamala Harris, as the vice presidential candidate. But when we're doing this, we're going to have a panel of mayors. I don't think there's any other university that could have the breadth of mayors that we have produced. It's pretty tough to be a Howard grad, because if you say I'm on the city council, we just look at you like, and so I'm very proud of the job that we do, and not only do they understand agency, but they seize agency.
Thank you, Dr. Spriggs. That was perfect timing to talk about, being able to recognize a Howard grad as we transition to our Chief Academic Officer, Provost Uqdah, to speak to our viewers and panelists. Welcome, Dr. Uqdah.
Thank you, and good morning, everyone. I was just enjoying the rich discussion and wanted to first thank Professor Spriggs, Professor Uqdah, Professor Harrell, and you, Dr. Carter-Nolan. This is such an important issue and such an important time in the history of the university. We just felt that it was important that we created an opportunity for our faculty experts, for our students, and for outside visitors to be able to participate in this conversation and this discussion about how we move from protest to policy. Beyond the events of today, which to many of us are not new and are not unique, but given the unique circumstances, we're entering an election season, we're dealing with a global pandemic, we're facing systemic racism reckoning. So I want to take this opportunity to thank Dean Williams, Dana Williams, and Dean Holly Walker from the School of Law for really taking the mantle to make sure that we organize an event where we can speak to the issues that are of importance to us and the issues that are of importance to our community, so that we can really seize this moment and make lasting change, and not just for the next news cycle and not just until the next tragedy occurs. So I want to thank each of you for your role and for the comments that you have brought and for your thought leadership. And I certainly look forward to hearing more of the discussion in the panels that are to come. But thank you, and I look forward to making sure that this becomes an opportunity for lasting change and impact for us.
Thank you, Provost Uqdah. Do we have any closing remarks from our panelists? If not, we would like to thank everyone for joining us. And I encourage you to join, we have additional panel discussions that will take place the rest of the week. So I encourage you to join us. Thank you very much and continue to stay safe.
Thank you.
Bye-bye.
Thanks, everyone.